Hey, my name is Meagan Clanahan. I am the co-owner of Houston Moms, and every month we bring you informative health videos from our friends and partners at UTMB Health. They are preferred providers for the Bay Area, League City, Galveston, all you people to the southeast. And so today we are bringing you a topic we have not previously discussed, which, I mean, there's so much that we always have to talk about, but we have Dr. Erin Cooney. She's with the UTMB Genetics team. And we are going to talk about what all of that means. Dr. Cooney, thank you so much for being here.
Thanks for having me.
So, what is it that you specifically support in your role at UTMB Genetics?
Great question. So, a lot of people don't know what genetics is. Um, Certainly, clinical genetics, a lot of people think of some scientist in a laboratory somewhere doing research projects, but I'm actually a physician. I went to medical school and then I did additional training in genetics. And as a geneticist, we really take care of patients across the lifespan, starting with prenatal, preconception, helping people through pregnancies make decisions, um, newborn screening when a baby is born, looking at potential genetic disorders they may have, childhood genetic disorders, adult onset conditions, and we even help with post-mortem evaluations whenever someone passes away unexpectedly and suddenly we want to try to help get answers for the family. So we really we work with every organ system, we work with every other type of specialist, and we're really diagnosticians. We're trying to figure out what is going on, what information can we try to find for this family to give them answers, and then from that, are there any potential treatments or things that we can do to improve someone's life?
Yeah. So, I mean, it's such a specialized field, but also encompasses a lot of things that can affect families. From a pediatric side, what made you want to get involved in this line of work?
I really enjoy the puzzle solving, the mystery. I want to try to give answers to people. A lot of parents end up on these diagnostic odysseys and they go from one provider to another provider. And a lot of these providers might be specialists in one body system. And so they might just be focused on just their organ. And really, as a geneticist, we get to think outside the box. We get to think about, the entirety of someone's life, but we also get to think about their family history. And I just really enjoyed that ability to be part of figuring things out. This is still, it's the newest medical field. And so we're still in our infancy, and that's exciting. I get to be part of this growing field and really seeing how genetics can change and change treatments. So, I every day I have variety. No patient is the same, no diagnosis is the same, and I really like coming to work and having something different every day.
So, if we were sitting and having coffee or Diet Coke as we are, um, although I always feel bad drinking Diet Coke on these videos because y'all are all doctors, and I'm like, oh, I'm just drinking my Diet Coke. Um, but if we were sitting having coffee, how would you explain gene therapy to a parent? What does that even mean? Because I'm not even sure.
Yes. So um, let me give you an example. So one of the first disorders that had gene therapy available is spinal muscular atrophy. This is a condition where a person is born missing the instructions, missing the genetic material to help keep their nerves intact. So the nerves that send information from your brain to your muscles in order to move your body, in order to breathe, without being able to maintain healthy nerves, those nerves are at risk of dying. And when they die, you lose the ability to move, you lose the ability to breathe. And so with spinal muscular atrophy, it's really a death sentence for infants who are born with this condition, because previous to gene therapy, there was nothing you could do other than just support the child through a limited life. With gene therapy, what we do is we're able to actually deliver the missing genetic information to that child's cells. So, if you think about it, you're born with two copies of your genetic information. One copy you get from your mom, one copy you get from your dad. And in spinal muscular atrophy, the two copies that you receive, neither one of them is working like it's supposed to. And so your body is missing that blueprint, that information on how to keep the nerves healthy. And with gene therapy, what we do is we are going to deliver many copies actually of that same genetic information, and we're going to put it inside the cell. And then the cells are able to use that to take care of the nerves. And the way that we actually deliver this medication, this drug, is it's one-time infusion. It is an IV infusion, but it's a virus. So what we do is we take a virus, and a virus is typically, they go to cells, they infect them. And instead of infecting them with viral genetic material, we infect them with the human genetic material a person is missing. And so the virus is basically, we take this virus, we remove all the viral components of it, and we replace it with that DNA that we want the person to receive. And so you give them this infusion with the virus. Essentially, you're infecting them, but you're infecting them with DNA. And so those viruses are going to go throughout the body. They're going to bind to cells. They're going to release that genetic information, and then that genetic information is going to be available to that patient to be able to use. This is very advanced technology. It's only been around. We're looking at the first decade here of its use clinically. And it's also the most expensive drugs in the world, at over, we're talking millions of dollars for just one infusion. However, you are essentially saving a person's life. And so, it's a very exciting thing to be able to give parents that hope. Years ago, when we make a diagnosis of spinal muscular atrophy, you would tell a parent, take your baby home and love them, because they're not going to make it to be able to go to school. They're not going to survive. Now we get to say, guess what? In a couple of months, we're going to be able to infuse your child with that genetic information they're missing, and we're going to stop this disease process, and they're going to live a life. They're going to go to school. They're going to walk. They're going to talk. They're going to get to do all the things other kids get to do. It's really exciting.
That is huge. And almost like beyond comprehension a little bit for like my head. So I'm so glad that there are people like you who do that. So you mentioned that one. Are there other diseases that y'all are working on? What else does that look like?
Yes, so we are also doing muscular dystrophy. And so that's
Mhm.
both Duchenne muscular dystrophy and Becker muscular dystrophy. There's a gene therapy called Elevidys that we use. And then we also have a hemophilia drug. So people who are born with the inability to clot their blood appropriately when they get cut or harmed. And these patients, if, essentially right now the treatment prior to gene therapy was you'd have to go get an infusion every couple of weeks with the missing protein that your body doesn't make. And so you're constantly in the clinics, and you're getting poked and prodded, for life. And with gene therapy, we're able to give them that genetic information so their own body can make that protein that they're missing. And so it's a one-time infusion. We're also able to do it for rare skin conditions. There's a condition called epidermolysis bullosa. And so we're creating actually skin grafts that are specific for that patient. And then also things like sickle cell anemia. The applications really at this point are endless. There's hundreds of drugs in the pipeline, and I anticipate about probably at least 30 being on the market by 2030.
Wow. Okay. And so I'm thinking to kind of our journey. So by way of explanation, my daughter is 15 now, but she has a congenital heart defect. So way back, I mean, 15 years ago, like even heart defect and heart disease, awareness and research has come a super long way for her, but we went through all the genetic testing to kind of see like, would it be safe for us to have another child? What do those conversations look like when you talk to parents? Like, are you doing those like conversation? Like, what does that look like? Do you know what I mean?
Yeah, so I work alongside a team of genetic counselors, and
Yes.
they are experts in not only the genetic information, but on counseling. So they understand how to give health information, they understand how to give bad news in ways that are most appropriate for families. And I love working with them. I try not to leave home without one. I want to have them in the room with me at all times because they're really good at making sure, that we are delivering information in a way that the parents feel confident, they feel like they understand it. And then we want to be available because, you get a diagnosis, you get information, and then you get home and you have like 100 more questions. So we want to be able to follow up and say, I want to come back, have you come back in a couple of weeks, let's talk about it again. We want, the other thing is, you have to think about families approach diseases in different ways. Some parents are extremely information seeking. Some parents are overwhelmed by information and would be, prefer to focus more on the here and the now. Like, what do I need to do today? And there's no right or wrong approach.
Mhm.
And so we really want to try to meet people where they're at and see what, how do they feel about information? What kind of information do they want to know? Certainly, there's some things that we need to let parents know. They have to know to help take care of their child. But beyond that, we really, we're here as a support to families. And so a counseling session can look many different ways, just depending on the disorder and the family.
Thank you for that word. I was trying to come up with it, but it's like I've slept since then. And so, genetic counselors, so you partner alongside them. Now, this wasn't a question we necessarily had written down, but because we're talking a lot about newborns and when, children are, coming onto this earth, like, and what we can do for them. What about those families who have been living maybe with genetic conditions? Our editor has spoken very openly, so I'm sure she won't mind me mentioning that her son has a progressive genetic disease, and they have searched high and low for an exact diagnosis, which took a really long time. With gene therapy, is there anything we can do for these children who are now, let's say, like 15, 14, 15?
Yes. So, well, and to go back to your comment about your editor, people think, so I only pretty much do rare disease. That's all I do all day long. In
Mhm.
fact, I've got some zebras. You can't really see them, like zebra figurines in the household, because when we hear hoofbeats, you're taught in med school to think of horses. But as a geneticist, we get to think of zebras. So when I hear hoofbeats, I get to think of outside the box. But you mentioned your editor has a child with a genetic condition. And, I tell people that each condition, each genetic condition specifically, is going to be rare on its own. However, collectively, genetic disorders are very common. And, whenever I meet people and they find out what I do, everyone has a story. Everyone either is related to someone or knows someone with a genetic condition. So they're
Yeah.
actually quite common. And so there are uh, treatments for conditions for adults. So, for example, sickle cell gene therapy is for 18 and older. For
Okay.
muscular dystrophy, it's 4 years and older, and we've done teenagers. So, genetic disease isn't just necessarily in a childhood or newborn period, but it's across the lifespan. Some actually don't even have onset of disease until you're in your 30s, 40s, 50s, or even 60s. And so, these treatments are being made not just for children, but for people across the lifespan.
So what I'm hearing is don't stop searching for the answers too, because I think that can be the frustrating part because you are the person who's like thinking outside the box and whatnot. And I think a lot of parents are too, because they're like, what is this? Like, what is
Yeah.
happening with my kid?
I
And
think
so,
the not knowing is sometimes hardest on these families. It's,
yeah,
and I hear it a lot, especially people who have kids who are maybe a little bit older, maybe they're adolescent age, and they've been looking for answers for 10 years, and they know who their child is. This answer is not going to change who their child is, but they just desperately want to know, what is this? Am I doing everything? That
yes.
that guilt of like, have I tried every avenue? And so I definitely, and I apologize for cutting off, but I would definitely say, if you have a medical home that you trust, even if you feel like this is just a supportive care option out there, I would say check in with your medical home every few years at least, because these things are coming, things are happening so fast these days. Another thing that parents can check out is there's a website called clinicaltrials.gov. Gov.
Okay.
It's a government website. And every clinical trial that is offered in the United States must be registered through that website. And so you can go in and there's filters. You can put in a disease name and it will pop up and it will tell you who has active trials, who's got completed trials. So this is another way that parents can kind of keep track of what things are coming down the pipeline. A lot of diseases also have foundations and they'll have newsletters. So I think I did cut you. I'm so sorry. You might have had more to that question, but I would say,
No, you're
there's different
good.
ways to stay up to date.
Yeah, no, I think that's perfect. And it's also, I just have found it's so important. You mentioned medical home, which I've never put it like quite that way, but like that you have a relationship with, your primary care, with your geneticist or whoever you're partnering with, that you are keeping in touch because we don't know. Like things have changed, like, and I can only relate to my kiddo, but she was supposed to have had another open heart surgery by now.
Wow.
She hasn't. And we keep going and going. And now it looks like her next one will be before she goes to college, but it'll be not open heart. It's going to be by like catheter. And that technology was not there 10,
Yeah.
15 years ago when she was born. It was just coming about. So I'm thinking of all these other kiddos, that there's just so much technology, so much that has happened. And you mentioned in just a decade, right?
Yes. And I tell parents, I let them know, when you deal with genetic disorders, you're also dealing sometimes with families where multiple people are affected, maybe a parent's affected, and they had a really horrendous experience throughout their life with this disorder. Maybe there was so little that was known. I've got patients, they go to the doctor and the doctors have never heard of their condition. They're looking it up. And of course, that doesn't make you feel very confident as a patient.
Yeah.
And so I let them know, like, hey, your child might have a very different experience than you did. The course of this disease, the tools that we have in our toolbox to treat it have changed. It's not the same as it was 10, 20, 30 years ago. There's diseases that didn't have guidelines 20 years ago, but now they do. And so, I always remind people, to check in every so many years because you just don't know, if things have changed.
Yeah, no, and be that advocate for your child. And I think that can be really tiring for a lot of parents. So what is your encouragement to them? Because this is a lifelong road.
Yes, you're doing a good job, first of all. Okay. Advocating is hard. The medical system is hard. There are situations that there's no good answer, there's no good resources, and parents are left in these really difficult situations where they're choosing between bad options. Which one is what option can I go with? I don't like any of these. And obviously these things are expensive. Insurance is complicated. They don't make it any easier on us. Sometimes you have a doctor you don't like. I would just say do what you can to take care of yourself. You can't take care of other people unless you take care of yourself first, and know that you're doing a good job. However that looks for your family. Every family's different.
Well, I think that is, wise advice for anyone, even if you don't have a child that has, is dealing with something like this. Are there any other resources? I know you mentioned the clinical trial resource on .gov,
Yes.
and we'll put that in the links below. But any other resources that you would recommend for parents, like either on this journey or starting this
Yeah.
journey?
So definitely find a good PCP that you trust and that you can have continuity with. If you have a child with complex medical issues, I know there are clinics where you get a different PCP perhaps every time you go in. Try to, find one PCP that you like and then stay with them. When you
Mhm.
call to make the appointment, make sure it's with that PCP. Now, obviously, if there's an urgent care need, you might get someone different. But in general, I would say if you have a child with complex needs, you need someone who knows that child, who knows their history, who knows what specialists they're seeing. It's just going to be a lot more helpful, even for general pediatric care. The other thing I would say is, finding specialists sometimes can take a really long time. Rheumatology has long wait lists. Neurology has long wait lists. I can take 6 months to get in to see me. So there's nothing wrong with seeking out multiple institutions at once and getting on the waiting list and seeing who you can see first. So UT Houston, has a bunch of pediatric specialists, Texas Children's, obviously, UT Medical Branch, and we're all relatively close. So at UTMB, we take care of patients all the way up from Conroe, El Paso, the border, all over Texas, come to see us. And, if possible, stay within one institution just so that all your specialists can see each other's documentation easier and can communicate easier. But if that's not possible, especially in the early days of trying to figure out what's going on and you end up in multiple institutions, that's okay. Just make sure that, you are able to have access to the notes, print them off, have copies, bring them to other visits just so that you're prepared when questions come up. Because we sometimes cannot see the other institutions information, and it can delay, it can make appointments really challenging where they're not as productive for you and for us, and we feel for you too. Some other resources I would say is early childhood intervention, ECI. This is a Texas resource. There's ECI for all of the states, but in Texas, ours is called Early Childhood Intervention. It is a state-funded, taxpayer-funded program for children from ages 0 to 3 years old. And what they do is they come out to your home in most instances. They do an assessment for your child. They see what they need help with, perhaps with physical therapy, occupational therapy, speech language, feeding therapy, and then they make a plan, and they can, in most cases, can come to your home. Now, what people don't always realize is that ECI, you do not require a physician to refer your child to ECI to have them come assess your child. A parent can refer their child, a grandparent can refer their child. A doctor, a nurse, anyone, you just go online. If you Google ECI or Early Childhood Intervention Texas, and you can find there's a form, you can fill it out, send it in. And they have, I can't remember if it's 45 or 60 days to get in contact with you and make the initial evaluation. This is, it's a, to my knowledge, it's covered through our taxes. And so this is something where you can get therapies that come to your home. And if you're a busy parent who has a child with a complex condition, you can feel like an Uber driver. You're going a million appointments. You're having to take off time from work. So having, therapies every couple of weeks at your house, I think it's really helpful for a lot of families. Another one that I would say is for school-aged children, and that actually starts at 3. So at the age of 3, you age out of ECI and you can get transferred to the school district system, where they have a preschool program for children with disabilities. It's called, it used to be called PPCD. It's now ECS. It's early. Oh my gosh, I'm gonna blank. It's special. I know it's off the top of my head.
It's okay.
Anyway,
We can
okay.
pop it in the
Thank you. How about
comments
that, right?
below.
Okay.
Yeah.
But essentially, it's a pre-K program where your child can be at school and get their services, their therapies at school, even starting at age 3. And I would tell parents to check out the Texas IDEA manual, like IDEA, like you're thinking of something, IDEA. Just
Mhm.
Google it, and you could Google even Texas IDEA manual PDF. I want to say the most recent one is from 2023. So if it says 2023 on the PDF, don't worry, it's not outdated. That's the most up-to-date one. Maybe it was 2022. It's about 100-page document. And so I don't print it off for everybody. I tell them just to Google it, but it has really great information on how to get your child assessed through the school system, what to expect at a school meeting, ARD meetings, how to create an individualized education plan, how to talk to your teacher about accommodations. If you have a grievance, what's a template letter that you might use to write to the school? It's 100 pages of really great materials that really empower families to navigate the school system with a child who has complex needs. I would also say that reach out, if you don't have a social worker involved with your clinic, I would ask the specialty clinics you might be involved with if they have a social worker. At UTMB, we have two amazing pediatric social workers, Pam Massey and Tia Janes, and they know everything. And they know, all these wonderful resources in our region. And so I would say, asking about, what resources are through the clinics can also be really helpful. It's ECSC. It's Early Childhood Special Education Services. That's what it is. Sorry. Okay.
No, you're good. And we'll put all those links below because especially intrigued about the school system PDF because
Right. It's a
that is
perfect
a
PDF.
whole thing. My child she has dyslexia and was in
Mhm.
speech and all of that, but like you have to learn to go to bat for your kid.
Yes.
And
Not all districts are the same.
no,
Some districts are great. Some
and
districts are
even
struggling.
and schools even in between those districts and we got very fortunate, but I mean there were a few times where I had to, you know, pull on my big girl pants
If
and
you want me
go.
to come back and do another one of these, I'm going to tell you guys if I can tell you about some tricks, with like just navigating ECI. That's like a whole conversation in itself.
Yeah, we can talk about some advocacy because I think it's super important. And I know that it's been a struggle for the people who I know who have, complex medical issues. Because,
Mhm.
from bus support to in
Yep.
classroom support. And then if they don't have a care worker that day, they just have to stay home. And,
Or thinking about the future, what is turning 18 going to look like for them? Knowing that you could stay in the school district till you're 21 if you are in special education services, knowing about work skills types of courses, knowing about when your child turns 18, if they have intellectual disability, how to become their legal guardian. I mean,
yeah,
there's so many things, housing for, a young adult with, disabilities. These are things that uh, there's not one place to find all these resources.
yeah.
So yeah, having a medical home that can help you navigate through the lifespan is important.
Yeah, we'll have to have you on and chat about all of that. I think that would be a really important conversation because, from ECI and I've experienced there, like it's great programs that I think more people need to know about. So, gosh, I've taken up too much of your time today, but I appreciate you joining us and sharing more about the UTMB Genetics program. So I'm going to drop all those links that Dr. Cooney mentioned below. So all those PDFs and the Gov and the clinical trials, we'll put that in the comments of the video below. Dr. Cooney, thank you so much for spending time with us.
Thanks for having me. This is great.
Yeah, absolutely. So we will be back next month with another informative video from our friends and partners at UTMB Health. Until then, it's a holiday. Stay happy, healthy, and safe this holiday season. We'll see you back next month.